Last week, I had a very bad cold. And at the same time, one of my friend who is also a CEO of another biotech company in Bengaluru was traveling to Brazil. And he also got cold there, winters. And then we both reached out to our nearest hospitals. I could easily get an antibiotic and I'm fine now. But he had to really struggle, go around, and the doctors were not readily prescribing him antibiotics. There's a difference between Brazil and India. Both are developing countries. In fact, India is bigger than Brazil, right? In terms of the economy, in terms of the healthcare services, I believe India is much better. But this is where there is a worrying trend. Even though my cold could have subsided without an antibiotic, I was prescribed one. Now, I'm not here to blame the doctor. I'm here to tell you that at Meditechnica, we are here to contribute towards the life of the doctors, and we are here to support you, and we completely understand why do you prescribe antibiotics. The whole world says that doctors readily are prescribing antibiotics. That's why AMR exists. But nobody is going into the psychology of why a doctor is prescribing antibiotic. Because most of the times people think that a doctor-patient relationship is a prescriber and a patient relationship. But doctors are much more than that. When a doctor is prescribing a drug or a medicine, his own credibility is also at stake. And if he prescribes a medicine here in India, by the way, the patient judges him. The patient judges him because if the medicine is not curing, he'll never return back to the doctor, right, next time. And he'll tell to all his family members, this doctor is not good, right? Now, sadly, in our country, sales, or rather its popularity, is the metric. So if the doctor loses patient or is not bringing business anymore, that's a problem, right, for the hospital. That's where it's all boiling down to one common question. But why doctors are not afraid in Brazil to not prescribe antibiotic is because the society there is different, right? So instead of saying that doctors are at fault, I would say the environment is at fault, the way we perceive doctors, right? We think that they're merchants. I am buying a product from them. Doctors are not merchants. Doctors are the central pillar of the entire healthcare system. And that is where today's video, how doctors can contribute towards One Health and Antimicrobial Resistance research. So let me start by asking you a simple question. How many times you have been prescribed antibiotic or you have prescribed antibiotic? Let me know in the comment section. Now, I'm sure you must have heard of antimicrobial resistance. You must have seen the COVID vaccine, pandemic. You must have seen how the virus traveled from a bat into humans, right? Zoonotic diseases, right? So the zoonosis and the AMR are closely interlinked, right? Doctors can actually influence AMR readily by rationally prescribing without the fear of judgment. But if they fear judgment, I think a wider discussion needs to happen in the doctors community that why should we be scared that a patient will judge us. Our degree should dictate us, not the patient's psychology, right? And then we have to avoid unnecessary broad spectrum antibiotics. We have to de-prescribe antibiotic whenever in fact we should also encourage the patient that never take antibiotic without a prescription. In fact, we have to stop selling antibiotic without a prescription. Today in India, you go to I think 100 meters from where I'm sitting right now, you go to a medical shop and ask for a Augmentin, he'll give you, right? Why? Why can't we enforce that regulation? If we can enforce regulations, AMR can be taken care of, right? So doctors stop prescribing and patients stop doing self-medication. Now let's come to the other side of it. The time has come that doctors become the stewards of antimicrobial resistance research, and they get into framing rules and policies for an AMR. Now that is where you can become an advisor to the Prime Minister's office, to the Ministry of Healthcare. You can help in reviewing high-risk prescriptions like ICUs. You can participate in audit and feedback cycles. You can involve yourself in training juniors and interns on how and why they should not prescribe the antibiotic. You can also get into epidemiology, surveillance, and data generation, which is the backbone of One Health, by the way, by creating a framework which reports a resistant infection so that other doctors can say that, hey, I prescribed this medicine, it didn't work. So I'm reporting a resistant infection. The faster we can report that, the more the awareness, right? Then collecting the clinical samples linked to the outcomes, right? participating in the national AMR surveillance networks. And that is where the veterinary antibiotic use is huge. Now, let's look at the chicken. We all love non-veg food, right? But nitrosofuran and many such antibiotics are being used, right? There are steroids being given to the chicken, and that easily travels to our body. Now, veterinary antibiotic use is also reaching, so it's like a zoonotic transfer of not the virus, but of course the antibiotic. We need to create a system so that we can do a surveillance of the food chain. And it is not just awareness, by the way. Many people think that awareness solves the problem. No. Solid steps from the regulators and the healthcare community can solve this. What's happening today is there is an absence of veterinary drug policies. There is no assessment happening for environmental risk assessment. The public health interventions are minimal, and doctors have the fear of being judged by patients. I think we have to overcome all of that. And at the same time, hospitals have to stop forcing doctors on outcome-based treatment instead of process-based results. So doctors should not be said that, hey, patients are not returning. What's wrong with your, I have seen many hospitals getting into unethical forcing of doctors to prescribe medicines. That should stop. Then, of course, studying of zoonotic spillovers like tuberculosis, leptospirosis, brucellosis has to be there. We have to track resistance genes across humans, animals, and wastewater. There should be a joint outbreak investigation where doctors are a part of it. The public health and policy input should be taken from the doctors, and the doctors must be aware that what happens when too much of reckless use of antibiotic is there. We should not just engage the international bodies like FAO, WHO, and WAH, but we should also create evidence-based policy grounded on clinical reality, right? Of course, we have to make the communities aware, and many of the stewards I know in AMR, they're just, trying to use AMR as a way to become popular, by the way. AMR is not a way to become popular. AMR is the only way to solve a problem. Like, okay, AMR exists, let's recognize it. Instead of posting on LinkedIn and boasting about it and talking in workshops, we have to really empower doctors so that they can make right decisions, clinical decisions for our patients. And One Health should be pursued across the spectrum. Today, I see a lot of chances of diseases traveling from wastewater bodies into animals, into plants, and of course into humans. Let's talk about Bangalore. So we have no flowing river here. All are stagnant water bodies, and they are being dumped with a lot of waste, and there is no treatment of that wastewater. It stagnates. The birds are feeding on it, and the food chain is getting impacted, and eventually it is already reaching humans. So it's not just Bengaluru city. There are many other cities which is going to suffer because of this. So the bottom line is, doctors should not be blamed for AMR. Doctors should be made the steward of AMR. Antibiotic resistance is real, and doctors should be empowered to become the gatekeepers of microbial evolution. They should be empowered so that they can make a decision without having the fear of getting judged by the patient or the hospital, which is the employer, by the way, and they should be independent to make decisions. Now, probably I have spoken a lot about AMR today, but I wrote a quotation just yesterday, and that was, criticism can only be stopped through results. So instead of criticizing doctors or criticizing that AMR is happening because of reckless prescriptions, I believe that it's time to empower the doctors. Then only we'll see results. All the best.